nasal cord or something, or Flonase. So you have to kind of play around with it, but I certainly advise you using something, because if you were to let it go, you now have swelling not only in your nose, but in the sinuses. And if the outflow tract of the sinuses get blocked because of the swelling, you could run the risk of getting a sinus infection, because now the bacteria that's getting trapped in the sinus, it usually flows out and you swallow it as it gets into the nose, you swallow it. It goes around once, it's warm, it's dark, it's moist. It goes around twice, it's grown more, and now the inflammation is more. It goes around another time. Now you got a rip-roaring sinus infection. So you want to keep everything open and clear so that you don't have to deal with that.
What about unknown factors that, did I say unknown because I'm talking about something that may be known, like mold in your house?
Yes.
That you just go like, hey, I've been living in my house for 50 years, and you live in Houston, let's say, because I know it's hot and humid there.
Yes. Yes.
And so there's always mold, and you can never really get rid of it because it's always humid. Talk about that a little bit.
Yeah, mold. If you ever have a leak in your home, a chronic leak or multiple leaks, and it rains heavily and you smell the smell of mold, there is mold. Even if you don't smell it, you probably should have somebody come out and look at things to ensure that you don't have mold, because some people are highly sensitive to it. Some people aren't as sensitive to it. But when you are, it can cause rip-roaring inflammation and get into your sinuses. The spores get into your sinuses. You're breathing it over and over. And just like we talked about over and over, if it's circulating there and causing this chronic inflammation, it can just become very, very severe. And if you can't get it cleared up, you got to get out of the home and get into something fresh and new, because it can cause really chronic, severe sinus infections, headaches, pressure headaches. And usually you'll see people, they'll blow out, they'll send me pictures. I got this black stuff in my nose, and then I'm looking at sending them to an infectious disease doctor. What should they be on? What can we put them on while they're looking to help clean up the house of mold, or move out of the house, or change the carpet, or whatever they need to do. Yeah, that can be very bad, and it's very serious, and you should take it seriously.
There's a question on here about nosebleeds. I guess in general, if someone just, there's nothing going on, but all of a sudden your nose bleeds, and you're not at high elevations, you're not putting something in your nose or picking it, it just bleeds. What are those causes?
Well, there are prominent vessels at the very front of the nose. Generally, 90% of nosebleeds are caused by vessels in the very tip of your septum. So you can usually control it by just pinching the soft part of your nose, just below the bones here. You can take care of 90% of the nosebleeds. It's either a prominent vessel. However, you also have to keep in mind that if you're on blood thinners for another condition, then your nose is very sensitive to you rubbing it or blowing it very aggressively, putting tissue up in there. If you just bother one of those little bitty vessels, it will cause a nosebleed if you're chronically on aspirin or one of the other blood thinners. The other thing is a deviated septum will be bent, and it'll stretch the mucosa and thin it so that when it's very dry and arid and there's not much moisture, if you were to rub your nose or touch it, it might bend and crack and cause a nosebleed as well. And so if you have it chronically, it could be any of those things. High blood pressure is a great indicator. A nosebleed is a great indicator that you might have high blood pressure too. I've had that happen where people come in, and so you want to just make sure your blood pressure is normal. See an ENT. Do I have a deviated nasal septum? If I do, when you get it fixed, we sew the mucosa back together with little dissolvable stitches, and that usually will take care of the nosebleed. And then if it's just something minor, you go into the ENT. We have a silver nitrate that we can just cauterize it with, and one or two little vessels. You cauterize it chemically, keep it moist, and that usually will shrink the vessel down and stop the nosebleeds.
Great.
We got to go back to the migraines, because people are asking, what about the migraines?
Let's hear it. Go.
So can we go back and touch on the migraines again? About, let's say I'm a sufferer for many years, and everybody's telling me it's the brain, it's neurological, and all of a sudden I meet you, at the Super Bowl and they go, man, where have you been? And you would
Yeah.
say what to me?
I would say, okay, here's what I see in my practice. I have helped thousands of people eliminate their migraines permanently by addressing specific abnormalities in the nose that I know that are triggering the trigeminal nerve. The trigeminal nerve is the main sensory nerve in the head and neck, anterior to the ears here. It innervates the forehead, the eyes, the nose, the mouth, the teeth, inside the nose, the sinuses, and the jaw. And when these abnormalities trigger the trigeminal nerve, that's when you get the referred pain. I can tell you, I've done it so much. When you tell me you have pain in your temples, I know where to look. It's the inferior turbinates. I just know, I've mapped it out. When you tell me it's behind my eyes, between my eyes, near my eyes, that's the middle turbinate, because the middle turbinate is higher than the inferior turbinate. And when they swell, they touch something, it gives you pain, retroorbital pain, we call it, or between the eyes. And so I know where to look. If you tell me I get pain at the top of my head, I know that's either the superior turbinate or it's the sphenoid sinus. Okay, so I know before I even look at the scan, that's where I'm going. What's this look like? What's this look like? And we have a very extensive questionnaire that tells me all this information. So my job is to have you come to see me, or you go get a scan, send it to me, or give me access to it so I can look at that, identify the abnormalities that I know are causing the problem and making you hurt where you're hurting, and come up with a surgical plan that's covered by insurance, takes about an hour, 1 week recovery. And 90% of my patients that I do this on never have another migraine. They might have a headache because they didn't eat, or a headache that's controlled by Tylenol or something, but not these horrible headaches. That,
You know,
that
when I get a migraine, I don't have them. But if a person gets a migraine and and they tell you it hurts here or here or here, what's actually hurting? Is it the brain? Is it pressure? Is it a nerve? What's actually hurting?
it's the triggering of the trigeminal nerve and the referred pain to the areas that are involved. You can imagine.
So, Doctor,
Yeah.
so you know what? Let me. I don't mean to interrupt you. So, what just came to
No.
me is like when you have like a spinal cord, right? And when that spinal
Mhm.
cord gets pressure on that spinal cord, you have pain radiating down your arm. Then you have pain, maybe your
Yeah.
sciatica. So, what
Yeah.
I'm hearing you say is exactly the same thing, but instead of the spinal cord, it's the nerve, and wherever that is pinching, that's where your pain is radiating. Correct?
That that's exactly it. You know, I have these patients. Here's a
Interesting.
very good analogy too. I have these patients who have hemiplegic migraines. They present as a stroke. They go
Oh,
to the ER. It looks like a stroke. They have slurred speech. They have weakness of their face. They have word garble. They have weakness or paralysis of their limbs. They might be paralyzed. They might be blind temporarily in an eye.
mm,
They might stutter. They might have seizures, or what they call pseudo seizures. And when I fix the nose, all of these symptoms have gone away in patients. All of them. So, of course, I'm reading up on migraines, and I found out that migraines are related or associated with 70 neurological disorders, but nobody knows why they occur more often together. Okay?
mm.
Here's a few of them: epilepsy, dementia, Alzheimer's, Parkinson's, autism, Tourette's, irritable bowel, Crohn's disease, retinitis pigmentosa, cerebral palsy. All of these, chronic fatigue, and the list goes on. So I happened to have a lady come into my office with migraines and MS who worked for a neurologist who diagnosed her. So there's no question what she has, okay? She had the migraines for 20 years, and then the last 4 years, she was diagnosed with this relapsing MS where she'd get this foot drop. So one day I saw her, and she was walking with a cane and came into my office, and I sprayed her nose down and looked in her nose. She had the abnormalities I know caused the problem with her headaches. But she came down an hour later and she wasn't using the cane. She goes, Dr.
Oh
Smith,
boy.
look. So I do a procedure. It's been 4 years, and she's had no migraines nor relapsing MS. So based on her, let's just talk about her. Based on her, I can say there's a high likelihood that the association between migraine and MS may be the nose. I had a Parkinson's patient, sleep apnea, chronic headaches, tremors like this. I did his surgery, headaches gone, no longer uses CPAP. And he goes, Dr. Smith, my tremors, they're like 80% improved. I mean, I'll get them if I get nervous or don't eat or something like that. But look, so with him, I can say the association between migraines, chronic headaches, and Parkinson's is the nose in his case. Now, did I cure his Parkinson's? No. Does it influence his Parkinson's? Yes, because the tremor is part of it. In fact, I had 3 hemiplegic migraine patients then who I listed the top 20 Parkinson's symptoms, and I asked all 3. I didn't tell them what it was. I said, I have these questions I want to ask you. And I just went down the road. Do you have this? Did you have that? Did you have this? Did you have that? One lady had 55% of the top 20 Parkinson's symptoms when she had her migraines. The next guy had 65, and the next guy had 75. And the last guy was like, you know what? My neurologist told me I was on the way to getting Parkinson's. And I was kind of thinking, well, if you have 75% of the symptoms and you look like a duck and you quack like a duck, yeah, he was probably right. So now I'm looking into what is this association? How does a deviated septum or nasal abnormalities or big turbinates, how is this influencing these neurological disorders?
Because it's so close to the brain, right? I mean, it's so close.
There you go. It is.
Right, because
the nose is there.
Yeah, and I read about I read a book on teeth, right? These kids out of Baltimore had the worst hygiene, but they had the worst health because the teeth were so bad it seeped right into their brain and into, because it's so close to the brain. If it was down in their legs, it wouldn't be that big of a deal. But it was so close to the brain and the ears and the eyes. It was just, there you go. It's just a mess.
Yes. Yep.
It's just too close to the stuff, right? It's too close to the CPU.
It's too close. And one thing that I read too, I'm always reading on this.
Michigan.
Michael J. Fox. I mentioned about Parkinson's. Michael J. Fox, I read, has had 2 septoplasties to correct a deviated septum. The deviated septum is the most common abnormality I see in the people with these hemiplegic migraines. And I already told you about the one Parkinson's patient whose tremors are now 80% reduced. So, getting a scan from Michael J. Fox might change the whole direction of the research, if it were influencing him and we can get him to just kind of calm down. What it's doing is this irritated focus in your nose is always triggering the nerve. It's always throwing you off. It's always making a short circuit of your nervous system. And since the body is made of nerves, if you have one area that is constantly tickling and fluttering and triggering, then something's got to give. Some people get abdominal pain that goes away after my procedure. Some people have diarrhea, chronic diarrhea, that go away after my procedure. I've had a lady told me, she said, Dr. Smith, my headaches are gone, but I've been constipated since I was 19 years old, and it's gone. And I'm like, or they had irritable bowel, and it's gone. These are the manifestations of the nerves being irritated here and causing problems elsewhere.
Wow.
Well,
doctor, we don't want to take up too much of your time because it's already been an hour.
Peg, I gotta again break in here because we haven't spoken. We haven't spoken about
my plug. Go ahead, honey.
We haven't spoken about the plastic surgery. The plastic surgery. Oh, right. Yeah. I know. We talked about the brain and the tinnitus and the apnea and the migraines and the deviated.
Right.
Well, you do plastic surgery. I mean,
Yes.
What about that?
I do facial plastic surgery, and the 3 main things that I do are rhinoplasties, eyelid surgery, and facelifts. That's my claim to fame. I kind of had narrowed it down after 30-something years to those three things with a little liposuction and things like that, or some laser. But I get great joy in making people look refreshed and natural. I must say, I make my patients look natural. They're not going to look stretched, abnormally stretched, pulled lips, things like that. You're going to look refreshed. And again, this procedure can be done in my office with IV sedation. I've done over, I don't know, 3,600 facelifts. They say that a plastic surgeon generally might do in a career 300-400 facelifts, but I've done 3,600 or so facelifts,
Wow.
IV procedures. And, I guess as we're talking about this, it was pretty interesting. I know that Jenner, right, she had her facelift and it got real popular. People talking about it. Very good result, by the way. But I remember on social media, there was a plastic surgeon that said he really appreciated her saying that a plastic surgeon did the surgery, this and that and the other. And so I kind of replied and said, facial plastic surgeons do great jobs too. One, because this is the only area we operate in. And for a plastic surgeon, to be honest, I'm sure their top procedures are liposuction, breast implants, abdominoplasties, so and so. And then you might get to the face and the nose. In fact, when I first came out in practice, there are things that I don't do thyroids and things like that. And I always thought about this. I said, let me just write all the plastic surgeons here in Houston and say, look, if you're uncomfortable with doing a rhinoplasty, don't feel like you have to be pressured to do that because your patient comes in and asks you to do it when you know you don't do a lot of them and it stresses you. Don't stress. Do the things you love to do. Send those to me. And sure enough, I had some take me up on that, and they would send me the rhinoplasty. Rhinoplasties are very intricate and detailed procedures. You have to know what you're doing. And a few rhinoplasties, might not get you there. A lot of rhinoplasties, you certainly know what you're doing. So a facial plastic surgeon, at least in my case, I've done thousands of procedures. It's the only area that I work on, and it's fun.
They want to know about Botox. Does Botox really help migraines?
It does help migraines, but it's a temporary fix. It's something you have to repeat and do it over and over again. There are also risks with doing Botox. If you get too much of it, you might get paralysis of a muscle that you don't want paralyzed for 3 months or 4 months or whatever. So yeah, if it helps you and you cannot have surgery, medications are good for people with migraines who are just too unhealthy to have a procedure, have a surgery. They don't want to do surgery. And so you have these other options between anti-inflammatory diet, anti-inflammatory medications, Botox, other meds that take care of migraines. They're all great options for you to have.
Okay, great. Fantastic. I will post all of this, you guys. I'll post the live. I will also post all of the information in the comments after we post it live. All the questions that were answered. I have a great person here in Vegas that does Botox, so I'll post that as well. Doctor, you can get me all your information and I'll just go ahead and just post all of that where they can contact you, your office, the name of your practice. Somebody was asking about the nose spray, the name of that, so I can post it as well.
Okay.
And we'll put everything on here for everybody. And it will just, stay on my page and Mel's page and your page and Terry's page. And you guys can rewatch it over and over and over again, which is nice. That's nice to have that availability of all this information.
Yeah. Well, I certainly want to thank you so much for having me on and allowing me to share this wonderful information to your listening audience. The thing that you have to realize, you're helping a lot of people by doing this. There's some people out there that know people who are suffering or they are suffering themselves. And so I commend you on what you're doing, and I wish you the very best and continued success.
Thanks, Doctor.
Thank you, Doctor. And we'll have you back on again. And Mel and I are going to fly out to see you. I think it's going to be.
Come on out.
Yeah, we're going to be I was thinking April, after we go to Pittsburgh for the draft. I thought we can instead of going back home, we can just stop and see you.
There you go. I like that.
There you go.
Yeah.
Okay.
Just let me know.
We'll reach out.
All right.